Welcome to In Focus with Ejaz Haider. Our top story tonight is a threat by Israel's Defense Minister Benny Gantz to Lebanon and Iran. Speaking at a conference, Gantz, the former Chief of General Staff of Israeli Defense Forces, said, and I quote, "Iran continues to seek nuclear weapons. Iran continues to upset the region. Iran has thousands of proxies in Syria, in Yemen, in African countries. It has cells in Europe and other countries around the world. We cannot and must not ignore this. We must not ignore its nuclear efforts and its negative impact on the Middle East," unquote. Gantz also talked about Lebanon and Hezbollah. And once again, I quote him, "While Hezbollah leader Hassan Nasrallah is our biggest enemy to the north, he is the biggest problem for Lebanon in Lebanon," unquote. Gantz's words come at a time when politics in Israel is showing further fissures. Thousands of Israelis have been protesting and calling for the resignation of Israeli Prime Minister Benjamin Netanyahu. Netanyahu is facing trial on corruption charges. He's also in power after he managed to stitch a deal with his arch-rival Benny Gantz. Netanyahu has tried to downplay the protests, but the gatherings only appear to be getting stronger. They are the largest since protests erupted in 2011 against the country's high cost of living. After moving quickly to contain the coronavirus earlier this year, critics believe Israel reopened its economy too quickly. The country is now facing a surge in infections. Confirmed cases have surpassed 82,000, including 592 deaths, while unemployment has jumped to more than 20%. Also, under the terms of the negotiated deal between Netanyahu's Likud and Gantz's Blue and White Party, Gantz becomes the prime minister after Netanyahu's rotational term ends in October 2021, or if Netanyahu gets indicted. To discuss this further, we are joined by Mustafa Khoschchesm, who's a journalist and analyst based in Tehran, has taught at a number of Iranian universities. We also have with us Leila Hatoum, who's a journalist, joins us from Beirut. Guy Burton, the visiting fellow at the LSE Middle East Center and an adjunct professor of international relations at Vesalius College in Brussels. Thank you to all my panelists. So let's go to Mustafa Khoschchesm. Mr. Khoschchesm, you heard Benny Gantz's statement. What do you have to say about that?
Alanna, thanks for having me. Well, it was interesting to see that, there were some people who were saying that it's just Netanyahu that's trying to, project the blame on foreign parties in order to derail public opinion about his corruption case and accusations. But now, seeing Benny Gantz in power, he's repeating the same Iranophobia propaganda. It's interesting that whenever they have problems back at home, they have demonstrations because of the coronavirus as well as because of many other things. They're trying to derail public attention to a foreign enemy, while at the same time, if you just listen to their media outlets from Israel as well as other Western states, they are claiming and they are bragging about, their sabotage operations in Iran. They claim that they are hitting Iranians in Iraq, in Syria, and elsewhere. So if it's true, then why should they be so much worried about, Iran and Hezbollah? As a matter of fact, the Israelis are doing propaganda in order not just to derail the public opinion from their domestic problems, but also in a move to encourage, the Americans and other states in the region that Iran is an arch enemy that could destabilize the region. Therefore, they are very much afraid that Joe Biden might win the U.S. election. So they are trying to, impress voters in the U.S. that this world, and especially a world with Iran standing against the United States and Israel, there needs to be a Trump administration in office, actually. They were trying to, they were doing the same in 2016. Exactly. They were, they escalated their propaganda about Iran, and they escalated their propaganda about Iranophobia, and they were trying to convince the world that the world needs to discard the JCPOA. The same, I believe, is happening right now, considering that in October, Iran's arms embargoes should be said, the world should say goodbye to Iran's arms embargo. They are trying to demonize Iran to convince the world, especially today, that the UNSC has a resolution to vote about the Iran arms ban. They are trying to convince the world that they need to extend the sanctions on Iran's arms trade. So this is a very vital moment, considering the problems they have at home. The Iran's arms embargo, the date that it will be gone, the sanctions will be gone in 2 months, less than 2 months from now, and also considering the presidential election in the U.S., I believe they are escalating, and intensifying the propaganda against Iran once again for all these reasons.
Okay, that's a good background to what's happening. Let's take this to Guy Burton. Ms. Burton, do you get a sense that Benny Gantz feels that Netanyahu is now under tremendous pressure? The trial is on. The left is obviously protesting. Do you think that by these statements he's actually trying to position himself in a way that for the Israeli voter to look at him as the strong man and the best possible choice to be the prime minister?
Well, thank you very much for having me on the show again. And to answer the question that you're talking about, sort of, where is Gantz in all of this? I mean, let's keep in mind that, Gantz and Netanyahu formed a coalition government a few months back. This was after the third election in the space of 2 years in Israel. The arrangement was that they were going to rotate. So Netanyahu would be prime minister for the first half of the administration and Benny Gantz for the second. Of course, this also coincided with sort of the increase in the number of protests that you've alluded to. A lot of that sort of, coming from I guess, politically from the left. Gantz is defense minister in this administration, and even before the current crisis in Beirut, even before the explosion that happened last week, he was talking about Israel hitting back against Hezbollah. There had been a number of spats, in the border region between the two, although I think both sides do not want, a direct or a confrontation in terms of a full-blown war. It's not in their interests. Now, also, it's worth keeping in mind that, Gantz and Netanyahu are having their own tensions between them. It's all coming to a head at the end of this month over the next budget. And if the budget is not agreed, there is a real possibility that Israel could be going to its fourth election within the next 6 months or so. If that happens, actually, Gantz stands to lose, because the polls are suggesting that in any election, it's not going to be Netanyahu. It's not going to be Gantz that's going to win. It's actually going to be the political right to the right of Netanyahu, which would actually benefit Netanyahu, because he can very well see a possibility of remaining in power, after another set of elections.
So going by that, Gantz would not want this particular dispensation to unravel. So perhaps whatever differences that he might have with Netanyahu would probably not allow those differences to reach a tipping point. That's exactly what we saw. I mean, he was constantly saying that he'll never partner with Netanyahu, but ultimately he did. So I think a lot of his initial, shall I say, idealism is now being, tempered by the ground realities. Is that something that you would agree with? I
mean, Gantz came into politics as pretty much a neophyte. his background was from the military as the head of the armed forces. He presented to some Israelis a refreshing change, especially as Netanyahu is pretty much the longest serving prime minister that the Israelis have had. But you're right. I mean, the idea that that Gantz does not want to see the government fall. I mean, in the last day or so, he's been talking about extending the time frame for the budget to happen so that Netanyahu can't force a new set of elections. But Gantz has taken a big political hit by joining with Netanyahu. When he did that, many of the people in his political coalition fell away from him.
Leila, Hatoum, you on ground zero, frankly. I mean, there's a cabinet meeting, I believe, going on, and you're reporting from there. Can you tell us what exactly is happening?
It's actually crazy. I mean, we had a massive explosion that stripped off most of the seaside from the port side in Beirut. Luckily, most of the damage, 70% of the damage was gone into the sea. So the 30%, which literally wiped out a radius of 2 to 3 kilometers and had a damaging impact of 15 kilometers radius, that was only the 30% of the mass explosion. It's not. People have a humanitarian crisis at the moment, and we're going into rain season by next month. So I don't know how we can find proper housing for almost 250,000 people, because we had over 70 to 100,000 units damaged completely.
Absolutely. Now, let's link up with what Benny Gantz said in the conference that I was talking about in my opening. He talked about Hezbollah, and he actually mentioned the Beirut explosion. And he said, well, this happened because they couldn't really store ammonium nitrate, such a large sort of, cache of it, and it went off. But he said Hezbollah stores its ammunition and other stuff among civilian housing. He actually talked about the fact that you've got a guest house, and there's in one room people are sleeping, and in the other room you might have rockets. And he kind of, on the one hand, warned Lebanon, and on the other hand also said that the IDF's task will be more difficult because of this sort of, proximity of Hezbollah's fighters and military equipment with the civilian population. Now that there are so many internal issues in Lebanon, how is the Lebanese government, I mean, if there is a government, looking at this Israeli threat?
Let me start with the last part first. We do have a government, despite the fact that the prime minister resigned yesterday. It's a caretaker government until somebody else takes over. And the caretaker government takes over business until basically a new prime minister and a new cabinet is appointed and elected and approved by the parliament. I have to say one thing. Benny Gantz and all of the Israeli generals who had at any point a hand in war against Lebanon used the excuse of basically terrorists having to hide arms and arsenal among civilians. And they've used this narrative also against the Palestinians. They've used this narrative against anybody they wanted to attack. But let's be frank also. I mean, the Israeli occupation forces go around civilians in Palestinian-occupied territories all the time. They use human shields, the Palestinians as human shields. They use their own people as human shields at any point when they have army bases at close proximity to all the settlements. So it's basically almost the same narrative everywhere across the world. So I don't know how he's using that against the Lebanese. That's one thing. The other thing is that I need to clear out one thing. The investigation into the explosion that happened at Beirut port on August 4th is not over yet. The idea is that we were supposed to have 2,750 tons of ammonium nitrate, which were supposedly highly explosive. But according to experts, the amount did not exceed more than 500 to 600 tons, which means parts of that went missing over the past 6 years. And this people need to ask this question. If Hezbollah is getting ready-made missiles, long-range missiles, high-tech missiles from the Iranians and their allies, why would they want to take ammonium nitrate and then try to use it as explosives in Syria when they can use ready-made bombs that they receive, right? That's one thing. The other thing is that there's a narrative, and it's highly plausible, that the ammonium nitrate shipment came to Lebanon because somebody wanted to give it to the Syrian opposition and the fighting groups on the ground, which supports the idea because ISIS, as of 2013, ISIS only came to existence in 2013, and they started their explosive trail end of 2013 until now. The first time that they used a mass explosion was when they used a tractor laden with explosives. Nobody knew the type of the explosives in Damascus. And the idea is that happened early 2014. So could it be that the parts of this ammonium nitrate was leaked to the Syrians bit by bit over the past 6 years, and they were used by terrorists in Syria against civilians over there? That's the main question to ask. Nobody should shy away from it.
But Leila, these you would agree at this point are theories and hypotheses, and they do not deny the fact that there was enough, ammonium nitrate stored in Beirut along the shore, which exploded and caused the terrible damage that we saw. So I think there are two issues here. One is about the ammonium nitrate sort of, being given away to bit by bit, as you said, to various groups, which, as I said, is a theory. And secondly, the ammonium nitrate that was actually there and which went off.
Let me just explain one thing. If Hezbollah wanted to store, I'm not supporting them, and I'm not basically defending their narrative as well. But if Hezbollah wanted to store their own explosives, would they do it at a place which is under the direct control of a party that opposes them? The head of the Beirut port at the time, and so for the past 15 years until now, is Hassan Kraitem, and he's a supporter of the Future Movement, which is anti-Hezbollah, which is pro-Saudi Arabia, which doesn't make any sense. That's the first thing. Second thing, they talk about tunnels under the port where basically other explosives were stored. First of all, the hangar number 12 was built on a rubble area that was used to rebuild that part of the sea. So it's not mainland. That's one thing. So you can't have tunnels underneath. The second part, where the international media shot tunnels, were actually under the silos. And under the silos, there are the operation rooms. And the army went out and explained that to people, but people literally, they go with fake news that there were basically tunnels underground, etc. Those were actually the operation rooms under the silos.
Okay, I've got to move on, Leila. Thank you so much for your insights. Mr. Khoschchesm, Leila had some theories. I want your opinion, and then go to Guy Burton before I wrap up this segment.
It's too early to decide about the realities. There needs to be fact checks and fact-finding commission. Under the Lebanese government, of course, I do believe that the Lebanese sovereignty must be respected. They have the capacity to run such an investigation, and they should be given the time and the space and freedom to go for a thorough investigation to see if it's been an incident or a rocket attack or a sabotage or whatever by the Americans or Israelis, as the Lebanese president suggested 2 days ago. All these are possibilities, but irrespective of this, of the results of such investigations, I have come across with so many similar instances when there has been man-made catastrophe and tragedy like war, explosion, a coup d'etat, and similar events, or natural disasters like earthquakes and landslide or floodings and so on and so forth, when the U.S. Takes the opportunity in order to, dismantle the reigning order in order to steer chaos and protests and, uncontrollable, unharnessed, chaos throughout a targeted country. And then on a third stage, they go for, erecting their own order and spreading their own order. This has been the case, and we are very much afraid. I'm personally very much concerned that if this is the case with this tragedy, then we might be soon seeing some kind of chaos in civil war, or chaos in Lebanon.
In Lebanon,
that's what the Israelis and Americans want.
Yes.
Exactly, that's what they want.
That makes sense. Thank you so much. That was Mustafa Khoschchesm speaking with us. Very quickly, Guy Burton, you talked about in the event of this current political dispensation in Israel unraveling, that the likelihood of the Israeli right, which is, as you said, right of Netanyahu coming to power. Now, if that happens, and of course we're jumping ahead of the curve here, but in terms of the worldview, in terms of the approach, in terms of threat perception and the rest of it, in the event of such a government in Israel, do you think there's a likelihood of, greater likelihood, shall I say, of a conflict in the Middle East?
If you're talking about in relation to, with Israel in terms of sort of a direct war, I think it's unlikely that we're going to see something, in the lines of something like, the Israel against Hezbollah war, which happened in 2006. What we're going to continue to see, though, is, Israel continuing its current policies, the status quo of sort of, hitting targets, especially Hezbollah targets in Syria. That's a way of sort of, both, keeping containment, preventing sort of the ability of Hezbollah to be able to acquire weapons and to get training and to get military experience there. But certainly in the context of sort of what would happen post another set of elections in Israel, it's very likely that we'll probably see Netanyahu back in power and continuing very much the same sort of policies and trends that Israel has been doing for the last 10, 15 years. So we wouldn't see a great deal of difference in that regard.
Okay, so much. That was Guy Burton speaking with us. We shall take a short break and return to discuss the rising COVID-19 cases in India, even as cases seem to be going down in Pakistan. Stay with us. Welcome back to In Focus. Our second story tonight is about rising coronavirus cases in India. As of today, India had 2.27 million cases with 45,257 deaths. 1.5 million infected people have recovered. Last Saturday, India recorded 848 deaths, the highest single-day deaths. Pakistan, on the other hand, has shown a downward trend with reported cases and deaths going down. Is this because of the population differential? Is it because of factors of density, larger population percentage in India living below subsistence level? Why is the mortality high in India, even factoring in the population differential? Supposedly, the genetic makeup is not very different from Pakistan. Did Pakistan adopt a better strategy to deal with the threat? There are a number of questions, and we would like to get our experts to analyze what exactly is happening. We are joined by Alanna Shaikh, who's a global health consultant and focuses on health systems and their response shocks. We also have with us Dr. Srinivas Rajkumar, who works at the All India Institute of Medical Sciences in New Delhi. And we shall also be joined by Dr. Ejaz Haider, who's a pulmonologist. But before I go to Dr. Rajkumar, according to the Union Health Ministry of India, on the plus side, the patients that have recovered from the infection and the number of patients that the recovery rate has jumped to 69.79%, which is a positive increase from the previous rate. At the same time, on the negative side, it's the 7th consecutive day that India, which has the 3rd highest COVID caseload in the world, has reported more cases in a day than the United States and Brazil, which have logged more patients than India since the beginning of the pandemic. Dr. Rajkumar, I believe we have discussed this previously also on this program, There are lots of unknown factors. Well, one of the things that I'm interested in, and I remember you telling me about the population differential, and I take that point. But let's focus on the mortality percentage. And my fascination with this has to do with the fact that, by and large, or at least if we talk about northern India, the genetic makeup of the people is more or less the same. So what could possibly be the reason for a bigger sort of mortality percentage in India than in Pakistan and also in Bangladesh?
So mortality rate, I guess, is not is decently well as of now in India, because the mortality rate is closer to 2%, if I am not wrong. Then again, considering the denominator, we have seen that zero surveillance studies have shown very high prevalence of cases. Only a part of them are being accounted in the regular testing process. So the actual prevalence of COVID cases would be far higher than what the data regarding testing would suggest. The discrepancy between the zero surveillance based on antibody and the test data. Then again, now we are seeing a trend towards moving of the pandemic from bigger cities to tier 2, tier 3 cities. So I think that plays a factor in the continuous surge of cases, and also the mortality could be higher because access to healthcare could be a problem when people from tier 2, tier 3 cities and also from the rural areas get infection. So it is predicted that at least in the next few weeks, there would be significantly higher number of cases, and after which there would be a downturn of the curve.
Okay, so Pakistan, we have witnessed, generally speaking, more cases in the urban centers than in the rural areas. Is that trend also the same in India?
The trend is changing. The initial burden of the cases was felt by the bigger cities. For example, Delhi was the initial hotspot, after which it was Mumbai. Then the whole state of Maharashtra had a significant number of cases. Then now it has moved to like smaller cities and also to other parts of the country. Say, for example, in the south, in Tamil Nadu, Karnataka, Andhra Pradesh, and again West Bengal, Uttar Pradesh. So other states are starting to contribute to the overall numbers which you are saying. So that is the reason why the cases are increasing, and mortality is primarily because of the poor availability of healthcare in rural and other parts of the country. So mortality rate is closer to 2%. It may see a minor surge because of the other factors which may contribute.
Right. The numbers I gave you are actually from the Union Health Ministry of India. Stay with me, Dr. Rajkumar. Let me pull in Ms. Alanna Shaikh. Ms. Shaikh, I have a different question for you. There's a report now from South Korea. It's actually on Monday, where their health officials and experts have found 3 new cases of what they say mutated genome sequences. And interestingly, these 3 cases, three of these cases are imported, 2 from Pakistan and 1 from Uzbekistan. And the mutated cases were found after an analysis of 776 COVID-19 patients, including 597 local infections and 179 imported cases. This seems to suggest that the virus is mutating. Now, could this be a plus in the event that it's weakening, or could it be a huge minus in the event that it's becoming more virulent?
So viruses mutate all the time. Mutation is one of the characteristics of viruses, so they will mutate, and it's not surprising that we see mutations with COVID-19. And you're right that mutations can happen in almost any direction. You can see mutations that make the virus more contagious or more dangerous, or you can see mutations that make the virus less likely to cause fatalities. And so it's a question of what does the mutation mean? The challenge with the virus that mutates is in terms of finding a vaccine for it. So you have to identify the parts of the virus that do not mutate and base your vaccine on those parts of the virus. Because if you base the vaccine on a component of the virus that then mutates, then your vaccine is not going to work.
Correct. But and you're absolutely right that viruses mutate all the time, and this one being an RNA virus compared to a DNA virus is obviously less stable. But the general sort of perception of this virus was that it was more or less stable, unlike the flu virus. So I thought this is an interesting thing in terms of what they found with reference to the mutations. Now, it seems to me that this data and this finding will be shared by the South Koreans with other experts across the globe. And that data, I'm assuming, will also be fed into the quest for vaccines, which I believe are happening at 6 or 7 different places in the world. Is that sense correct?
So we've been seeing reports of mutation in COVID since April or May. We've been noticing that this virus is mutating for quite a while now, and new surveillance technology, new computer analysis has let us identify mutations in COVID faster than we've previously been able to identify mutations in viruses. So in a way, it's good news that we noticed it so fast. And you're right, this information is going to be shared globally, and vaccine manufacturers, vaccine developers will take that into account as they work on it. And in fact, one thing we've learned is that the spiky corona surface of the coronavirus is prone to mutation, which means that we can't base the vaccine on those spikes.
Okay. Stay with me, Ms. Shaikh. Let me hop back to Dr. Rajkumar. Dr. Rajkumar, what is the policy about tracing, tracking, and quarantining in India?
So the initial strategy was about extensive contact tracing, then again testing. But now it has moved to more of a symptom-based approach. So asymptomatics are not widely tested. It is more of patients who are symptomatic are asked to either home quarantine or come to the hospital if they have severe symptoms. So aggressive tracing and testing, if it was done, like you would not have seen such upsurge of cases. So because of the logistic limitations, and again availability of testing, though we have increased up to 250% from even July, but still it is not able to keep up to the demand of the whole population. So that is why you are seeing upsurge of cases. So the strategy as of now is to provide adequate oxygen and other facilities for people who are falling sick, and the asymptomatics are suggested home isolation so that they can get help whenever required. And some states have also started to provide home-based pulse oximeter and other kinds of monitoring. So the strategy is quite different from what other countries are able to do in terms of like ground level implementation.
Right. Aggressive testing, like, the South Koreans and some other countries hasn't happened in India or Pakistan, or for that matter in the United States and Brazil and the rest of the world. But tell me, Dr. Rajkumar, to me, it seems that the infected people who are asymptomatic are kind of, in terms of sort of, projecting the chain, are dangerous. Are they weak vectors by dint of their being asymptomatic, or they can be, in terms of the virulence, they can be as bad as the symptomatic COVID patients?
The current published literature says that asymptomatic individuals are as infective as people who show symptoms. So, as you said, a testing-based strategy, extensive testing, is the only way to end this pandemic, and this has been voiced by several experts. Asymptomatics are a real threat to containment of the pandemic. Unless we are able to do extensive contact tracing and testing, there is no way that pandemic is going to end sooner. This symptom-based approach is going to prolong the pandemic for a longer duration, as several experts have raised concerns about symptom-based treatment approach.
So you basically say that despite the various constraints, ultimately India will have to begin to go for aggressive testing if it wants to make sure that A, it flattens the curve, and B, that it ultimately gets rid of the pandemic itself.
Absolutely. Extensive testing, tracing, and treatment is the only way any country in the world will be able to contain the pandemic faster. The lesser the testing and the more increased reliance on symptom based treatment and even treatment seeking after symptoms will make the country bear the brunt of the pandemic for a longer duration. There is no way you can get away without testing sufficiently.
So are there any signs that the government, I'm assuming that, you being an expert, and I'm sure there are, thousands of other experts in India, medical professionals who must be sharing your view, that is this view have some kind of traction with the government in New Delhi?
The government is doing all it can to increase the testing. ICMR has been very serious about testing labs in several parts of the country which don't have facilities. For example, in Bihar and Uttar Pradesh, they have increased the testing capacity tremendously. But as also I said, that the scale of the country and other constraints, like states which have not invested in healthcare, because health being a state subject, states which have not invested in healthcare for over decades, it is very difficult to create makeshift facilities which can treat a pandemic of this scale at a desirable quality and also cater to its people. So because places like Delhi, which were centers of health for the neighboring states, they were obviously able to manage the pandemic well. But considering the movement and lockdown restrictions, people of neighboring state are not able to come to cities like Delhi, which are itself like hotspots. So that has created a little hindrance in the way the management.
Yeah, right. I get it. That's the dilemma. Thank you so much. That was Dr. Srinivas. Rajkumar speaking with us. Let me go back to Ms. Shaikh. Ms. Shaikh, it seems to me that life is not going to be very normal, or shall I say there's going to be a new normal, or shall I say there's going to be wearing the mask normal now. Is that sense correct?
I would say that's correct. We're not going to see anything like the normal life we had before until we have a vaccine, until that vaccine is made available to everyone in the world. Until then, if we want to keep the virus from overwhelming us, which as we can see in many places it already is, it's going to mean masks, maintaining our physical distance from other people, limiting our social gatherings, not getting into big crowded groups, avoiding recycled air and close quarters until there's a vaccine.
Absolutely, but it seems to, as Dr. Rajkumar was also saying, that lots of countries, in fact, even in the developed world, really countries don't have the full resources to deal with this, or it's extremely difficult for countries, unless you are, like North Korea perhaps, to make sure that the people behave in a responsible way right to the last person.
It is terrifically difficult to get people to change their behavior.
Because
it's one of the great challenges of global health.
Absolutely. I mean, because, one comes across one's own sort of circle of friends and others, and you talk to them from a distance digitally for the last 6 months, frankly. And one can see that there is a sort of, frustration building up in terms of not being able to go out freely and, entertain people and travel and the rest of it. So I think that's kind of telling on people.
It is. It's wearing on everybody. It's a situation where what we've been taught to do to take care of our mental health, go out, get fresh air, get exercise, make contact with our friends, is at odds with what we have to do to protect our physical health, which is stay away from other people and wear a mask. Like, it's a terribly difficult situation, and people are going to find it really difficult.
Absolutely. Thank you so much. That was Alanna Shaikh speaking with us. We now have Dr. Ejaz Khan with us. Dr. Khan, thank you once again for being on the program. I was earlier talking to Dr. Rajkumar, who, in terms of the increasing caseload in India. Well, the government here, or at least the government figures put out, claim that we have a downward trend. And so we want to open up everything. In fact, marriage halls and tourism has also been opened up, and there have been concerns about the economy and the rest of it. As an expert and as a pulmonologist, do you think we are going towards opening up somewhat too soon after Eid al-Adha, and then we are also going to enter into Muharram shortly, and there are going to be religious gatherings and the rest of it?
Thank you very much. I think we can argue on either way. If we look at the trend, there was a fear that after Eid al-Adha, we will have a surge of cases, which really did not happen, although our reproductive number has gone up 0.069 to almost 0.93 as of yesterday. But it did not increase as it was initially predicted. The question was, should we slowly go back to normal, or we just lift everything up and then deal with as the situation arises? As you know, there's always a question of the economy as well. So that's also a consideration in making any decision. If you look at the numbers today, only 10% of the beds are now occupied by the coronavirus patients. So 90% are empty. So this is very encouraging news, which probably prompted the authorities to make the decision to lifting up the lockdown.
Okay, so here's according to one report from South Korea, it says the new coronavirus infections fell below 30 on Monday as imported cases slowed, but church-linked infections continue to strain the country's antivirus fight. And the church-related, it's about the religious congregation where people are kind of stacked close in a church. So my point is that, one, we have been testing for symptoms, so we really don't know how many asymptomatic cases we have. And unless we know that, and that can only be known through aggressive testing, but our testing capacity or our testing regime, the number of tests has come down. So some experts have voiced concern because of that.
It's very interesting. If you could allow me to divert a little bit what happened in the science. There was a very interesting study. The asymptomatic patients, about that, 40% patients, as you know, are asymptomatic. What the study is, which also published in mid-March and now in Science this year, they have tested people who were with the sera they have stored before the coronavirus in 2015 to 2018. And they found the T cells, which is called the memory cells, were reacting to SARS-CoV-2. So they were never exposed to that virus before, but the sera T cells were positive in those patients, are memory cells. So that means that probably we are dealing with a cross-reactivity of a common cold coronaviruses. So this, it intrigues everybody. Why Pakistan? The number of cases is much lower than anywhere else, our neighbors, Iran and India, for example. So these studies came very, very interesting right at the time when we are looking into this one. And plus also the mask wearing in helping in the number of cases down. You talked about the church. Now, there's a study published now. There are 4 or 5 studies recently published from the cruise ships, from the prisons, and from the nursing homes as well. 80-90% are positive, but you do not look into positive serology. What you need to look at, were they symptomatic or not? Majority of patients, up to 80% of those patients who tested positive never had symptoms, which is a good news. So maybe if we talk about the church, we talk about the serology, that's a good news. If do not have symptoms, then it's a very good news that they could be positive. They could be positive because they have been exposed, they have a milder or no disease at all in terms of the symptoms, but they have developed this immunity. So I think what the new studies are coming in, which is very intriguing. For example, they're looking at the receptors in the children, the genetics, the role of T cells, the memory cells, not the B cells, which makes the antibodies. So far, we have been focusing on the antibody responses, but now it is being slightly shifted towards another kind of cells, which is called T cells, memory cells, which fight against any invading antigen. So I think if we look in this way, that maybe the antibodies are going up serology testing and they are asymptomatic patients, which maybe are good news.
Okay, great. Thank you so much. That was Dr. Javed Hayat Khan speaking with us. This is all from In Focus tonight. We shall see you tomorrow at the same time. Keep following our latest updates on social media at indus.news. Good night and goodbye.